A new study has raised serious concerns about the impact of social media influencers promoting health tests with limited evidence to back their claims, warning that such behavior could lead to harmful consequences for the public. The research, led by the University of Sydney and published in the American Medical Association's JAMA Network Open, analyzed the promotion of 5 controversial health tests, including full-body MRI scans, genetic cancer screening, testosterone tests, the egg timer fertility test, and gut microbiome testing. The study found that these tests are often presented as essential for health management, despite the lack of robust evidence supporting their effectiveness for generally healthy individuals. The majority of posts, 87.1%, emphasized the supposed benefits of these tests, creating a sense of urgency and fear. They portray these tests as a way for people to take control of their health, often with emotional appeals such as the notion that failing to undergo these tests would mean neglecting one's well-being. However, these posts overwhelmingly ignored the potential harms, including overdiagnosis, where individuals are diagnosed with conditions that are unlikely to cause harm, and the psychological and physical toll that unnecessary medical treatments can have. Alarmingly, only 6% of posts mentioned overdiagnosis, and less than 15% acknowledged any potential harms, even though these risks are significant. The study uncovered a pattern of fear-mongering, with influencers making exaggerated claims to encourage followers to take the tests. One example was the promotion of gut microbiome tests by an influencer who claimed they could provide certainty about health issues and implied that failure to take the test would result in missed opportunities to improve one's health. Similar tactics were used for other tests, such as the egg timer fertility test, which is promoted to younger women as a way to predict their future fertility. Despite its lack of scientific reliability, this test preys on insecurities and may cause unnecessary anxiety, pushing women towards expensive interventions like egg freezing or IVF when they may not need them at all. The study's findings also highlight a disturbing trend of medical misinformation on social media, particularly in posts that come from influencers with significant followings. Many of these influencers, including doctors, use the platforms to promote health tests and treatments without properly informing their followers about the risks involved. For instance, one medical doctor promoted the multi-cancer early detection test, suggesting that regular testing could virtually guarantee the early detection of cancer, without acknowledging the potential for overdiagnosis or the psychological distress caused by detecting non-threatening cancers. These types of claims not only mislead the public, but could also drive people to undergo costly and unnecessary treatments. Another troubling example was the promotion of testosterone tests, which were often linked to narratives around masculinity. Influencers presented low testosterone as a major health threat, claiming that men who do not wake up with an erection may be suffering from a testosterone deficiency, thereby encouraging men to take the test and potentially pursue testosterone supplements without understanding the long-term health risks. The promotion of testosterone supplements, in particular, is concerning given the lack of long-term safety data, which could expose individuals to serious health issues. A major concern raised by the study is the growing trend of selling these tests directly to consumers, bypassing the medical professionals who should be involved in such decisions. By removing the doctor from the equation, individuals are left to navigate potentially misleading information on their own, without the guidance needed to determine whether these tests are truly necessary or beneficial for their health. While some posts from medical professionals were more cautious and acknowledged potential harms, the study found that even doctors were guilty of promoting tests in a way that could encourage unnecessary testing and treatments. The fact that many of these influencers have financial stakes in promoting the tests further complicates the situation, as followers may be unaware that the recommendations are financially motivated. The study's findings are a stark reminder of the risks of unregulated health advice on social media. Professor Stacey Carter, director of the Australian Centre for Health Engagement, Evidence and Values, emphasized the importance of recognizing that these influencers are often promoting tests that are not only unproven, but could also be potentially harmful. With medical misinformation so prevalent on social media, Carter urged individuals to be more discerning when influencers encourage them to take health tests and to consult with a medical professional before making any decisions. In conclusion, The study makes it clear that stronger regulation is needed to ensure that influencers and companies are held accountable for spreading misleading or harmful health information. The onus should not be on individuals to sift through potentially damaging misinformation. Instead, there must be clear guidelines in place to protect the public from the dangers of fearmongering and overdiagnosis. Until such regulation is in place, consumers must remain cautious when encountering health-related content on social media and should always seek advice from trusted medical professionals before taking any action.